The Honourable Minister of Health.
Thank you, Mr. Speaker. I am pleased to begin debate today on Bill C-37 to address a serious and pressing public health matter, to improve public safety and to protect the health of Canadians.
I look forward to working with all members to advance this important legislation, including, in particular, with my new parliamentary secretary, the member for Louis-Hébert.
Legislation is introduced in the context where Canada is facing a national public health crisis related to opioids, characterized by ever-increasing rates of harm, overdose, and death. The opioid crisis raises many concerns, and the one that we hear about perhaps most often is the rapid rise in the numbers of deaths from accidental overdose. Last year, in British Columbia alone, more than 900 people died from overdose. That is an 80% increase from 2015. The majority were linked to the swift spread of powerful drugs like fentanyl. Alas, the situation is getting worse. Last week, it was reported that there were 20,000 overdoses in British Columbia alone. At a national level, deaths from overdoses are now more numerous than deaths caused by motor vehicle accidents.
I should go no further without acknowledging my condolences to the families and friends who have suffered the loss of loved ones. We share their grief. We recognize the grave need to turn the tide of this crisis as quickly as possible.
I would also comment at the outset that while the focus of this legislation is on immediate action to address the opioid crisis, we must bear in mind that lasting solutions require an understanding of the roots of the opioid crisis, which are messy, but they are not mysterious. It should be acknowledged, for example, that pain is a central theme at the heart of the drug crisis. Sometimes problematic drug use begins with physical pain, but we must also admit that emotional pain is a factor in substance use. To fully resolve the opioid crisis, we must address the multiple social drivers, including poverty, social isolation, childhood trauma, sexual abuse, and mental illness. Addressing the roots of the crisis demands a whole-of-society response. It means calling out stigma and discrimination as barriers to accessing care. It means building a society where children receive tender attention and adults aren't isolated and lonely. It means an international search for effective answers and being willing to discuss bold policy alternatives and the evidence associated with them. We must deal with this crisis comprehensively, collaboratively, compassionately. We must assess what works and what doesn't work, and then we must do what works. The crisis is moving eastward in Canada, with more drug seizures of fentanyl and carfentanyl. Les Canadiens et Canadiennes comprennent de plus.
Canadians increasingly understand that problematic substance use can affect anyone, people of all ages, and of all socioeconomic groups, which can have devastating consequences on individuals, families, and communities.
Here I have met with bereaved parents, with people who use drugs, with first responders, addiction specialists, mental health experts, Indigenous leaders, health educators, and others to learn their perspective on the challenges we face. A complex, multi-dimensional social challenge of this nature demands timely, coordinated, effective action. Before I discuss the details of this proposed legislation, I would like to thank many members of this House who have been outspoken on the urgent need to respond together. I thank the member from Vancouver Kingsway for his support and advocacy on the issue, and especially for his calls to pass this legislation by unanimous consent. Je tiens aussi à
I would also like to thank the Standing Committee on Health. The members of that committee have been engaged on this issue and have provided a series of recommendations that we have reviewed closely, and we have already acted on these. I look forward to formally responding to the committee's report in due course.
There are many important components of this proposed legislation that will support communities and enhance public health and public safety when it comes to the use of drugs and substances. Bill C-37 will save lives. It needs to be passed without delay. At this point, please permit me to outline some of the federal actions to date on the matter. Early last year, we made naloxone, the antidote to overdose, available without prescription. We arranged an expedited review of naloxone nasal spray and ensured an emergency supply for Canadians. We granted an exemption to the Dr. Peter Centre in Vancouver to operate Canada's second supervised consumption site, along with an unprecedented 4-year renewal of the exemption for Insight in Vancouver. Last summer, we announced Health Canada's Opioid Action Plan to improve education for the public and prescribers, to expand access to treatment and build the database. In September, we overturned a ban on the use of prescription heroin so that it is available to treat the most severe cases of addiction. Our government has supported the Good Samaritan Overdose Act to remove the fear of drug possession charges for individuals who call 911 when they witness an overdose. We added regulations to schedule fentanyl precursors as controlled substances, making it harder for illicit substances to be manufactured in Canada.
In November, along with Ontario Health Minister Hoskins, I hosted a national conference and summit on opioids, which produced a joint statement of action to address the opioid crisis. The statement contains 128 individual commitments from Health Canada, 9 provincial and territorial ministries of health, and more than 30 other organisations. In February, we will update Canadians on the progress of these commitments.
In work led by the Minister for Public Safety, the RCMP now has an agreement with China to combat the flow of illicit fentanyl. Because this is a national crisis, we activated additional supports. In collaboration with the provinces and territories, we've established a special advisory committee on illicit opioids that includes the Council of Chief Medical Officers of Health to advance information among jurisdictions related to the opioid crisis. We have built a task force within the federal health portfolio to work with other federal departments in a comprehensive response to the crisis. We funded McMaster University to produce new evidence-based guidelines for prescribing opioids for chronic pain. They are now available for consultation. We funded the Canadian Research Initiative in Substance Misuse to provide evidence-based guidelines for medication-assisted treatment. And with the support of the Prime Minister, we identified new federal funding of $5 billion over the next 10 years to address mental health and addictions. We know that untreated mental illness is a common cause of addiction, and early intervention is key. We introduced the new Canadian Drugs and Substances Strategy to reinstate harm reduction as a pillar in Canadian drug policy and return the lead for drug policy to the Minister of Health. In December, I introduced Bill C-37, which proposes to amend the Controlled Drugs and Substances Act and other acts. This legislative framework is an important part of our comprehensive approach to drug policy. It aims to accomplish 3 important goals. Number 1, to provide support for harm reduction, in particular the establishment of supervised consumption sites. 2, to reduce the supply of illicit substances. And 3, to reduce the risk of diversion of other illegitimate controlled substances. Evidence shows that when properly established and maintained, supervised consumption sites in communities that want and need them will save lives and improve health without increasing drug use or crime rates. Last year, I visited Insight in Vancouver to witness the important work that it does to help vulnerable people and communities. I was moved by what I saw. A facility like Insight promotes health-seeking behaviour by introducing people who use drugs to the health system in a non-judgmental and non-stigmatizing manner. They have hygienic facilities, sterile equipment, and are supervised by qualified health professionals who provide advice on harm reduction and treatment options, as well as prevention of overdose. Under the Controlled Drugs and Substances Act, the Minister of Health has the ability to provide exemptions to allow supervised consumption sites. But the Respect for Communities Act from the previous government introduced unnecessarily onerous requirements that must be met by communities before the Minister of Health could even respond to the request for an exemption. We have heard desperate cries for help from communities most affected by the opioid crisis. They have indicated that the current requirements are burdensome and hinder their ability to offer services needed to reduce harm and to save lives. Currently, there are applications being reviewed by Health Canada from across the country, from communities such as Vancouver, Toronto, and Montreal. Proposed legislation would simplify and streamline the application process for communities that want and need to establish supervised consumption sites. It would replace the current 26 application criteria with the 5 factors outlined in the Supreme Court of Canada 2011 decision regarding Insight. In fact, the criteria in the proposed legislation are exactly those written in paragraph 153 of the Supreme Court decision. A vital criteria Bill C-37 retains is the requirement for community consultation. It improves transparency by adding a requirement for decisions on applications to be made public, including reasons for denial. To support these proposed changes, Health Canada would post new information online about what is required in applications, how the process works, and the status of applications. Pour éviter que des opioïdes
To avoid the presence of opioids and other illegal substances on Canada's streets, we must make sure that it is not easy to actually produce them. To accomplish this, this legislation proposes to prohibit unregistered importation of pill presses and encapsulators. This action is, in part, at the request of jurisdictions such as British Columbia. Whilst these devices do have legitimate uses, they can be used to make counterfeit drugs that can be laced with dangerous substances, including fentanyl.
This legislation would also give Canada's border service officers greater flexibility to inspect suspicious mail, no matter the size, that may contain goods that are prohibited, controlled, or regulated. Protecting the privacy of Canadians is of the utmost importance. The measure would only be for incoming international mail where the prevalence of illicit drugs is greater. In fact, just one standard-sized mail envelope can contain 30 grams, enough fentanyl to cause 15,000 overdoses. Enfin,
Finally, the bill updates a number of compliance and enforcement provisions of the Controlled Drugs and Substances Act in order to modernise the Act. We have over 600 licensed dealers under this legislation that manufacture, buy, sell, distribute, import, export and transport controlled substances for legitimate purposes. The proposed amendments would allow Health Canada inspectors to conduct inspections in a range of scenarios, including any place where activities with controlled substances are suspected to be taking place. These changes would help prevent the diversion of licit substances into the illicit market.
Bill C-37 supports our government's new Canadian Drugs and Substances Strategy, which the Minister of Public Safety and I announced on December 12th. In the past, federal drug strategies aimed to balance public health and public safety objectives through key pillars of prevention, treatment, enforcement, and at times harm reduction. But in 2006, under the national anti-drug strategy of the previous government, the harm reduction pillar was removed. Our government will pursue an evidence-based approach to drug policy. Accordingly, this new strategy formally reinstates harm reduction as a key pillar, in addition to prevention, treatment, and enforcement. It should be noted that the reintroduction of harm reduction does not diminish the importance of the other pillars. In particular, we must not let up on our efforts for prevention and treatment. I will continue to encourage the expansion of access to a broad range of treatment options, which are essential to reducing the number of overdose deaths. In reframing problematic substance use as the public health issue that it is, it returns the lead to the Minister of Health from the Minister of Justice. In conclusion, the opioid crisis has taken a toll on many communities across Canada. It requires swift action, as well as a more balanced approach to deal with problematic substance use. Our renewed, evidence-based approach will allow the government to better protect Canadians, save lives, and address the root causes of the crisis. Canada needs this action now. While our focus must be on the current crisis, we must also pursue a balanced approach over the long term to address the upstream causes of problematic substance use. We
will continue to work with our partners, including provinces, territories, municipalities, and Aboriginal communities.
To end this crisis immediately, we can markedly reduce its impact and set ourselves on a path to health for all. Measures proposed in Bill C-37 aim to take swift action to address the opioid crisis. I call on honourable members of the House to support passage of Bill C-37 without delay. Thank you.